Tennessee and Virginia senators say they are working to fix some major disadvantages, unfairly punishing hospitals and communities nationwide. In fact, some within Ballard Health System here in the Tri-Cities region.
Ashley Sharp joins us tonight with a special report looking into this problem and what's being done to fix it.
Josh, Sarah, data shows rural hospitals are closing at an alarming rate, with 130 closing nationwide since 2010, more than 20 closing in 2020 alone. So why are the cards stacked against rural hospitals? It's an issue that we're diving into deeper as local health leaders and lawmakers are working to save these hospitals from closure. In a post-pandemic world, problems that were already plaguing rural hospitals nationwide have been made worse.
I think that rural hospitals were left in the dust long ago.
Ballard Health's president Alan Levine says that of the hospitals in its system in Northeast Tennessee and Southwest Virginia, all of them are classified as rural, even the 5 biggest, most successful hospitals.
As urban areas up in New York, Massachusetts, California, as those hospitals get paid more money, by definition, our hospitals get paid less.
He says it's a system driven by current policy that is designed for rural hospitals like theirs to fail.
The more efficient we are, the more we get penalized.
Currently, the way hospitals are reimbursed by Medicare for their patients is much lower for providers in rural communities. Take Nashville's TriStar Centennial Medical Center and Johnson City Medical Center as an example. Both hospitals have a comparable number of patients discharged at 30 and 24,000. But Nashville's hospital has $862 million in patient revenue compared to JCMC's $454 million, and Nashville's operating income is $200 million to Johnson City's $23 million.
If they have roughly the same volume and one has twice the revenue, you have to ask yourself, what's the policy behind that? Why is that happening?
It's a problem that now has Virginia and Tennessee U.S. senators reaching across party lines to find a solution. Senators Blackburn, Warner, and Kane have introduced the Save Rural Hospitals Act of 2021.
This would be a bill that would really help hospitals out.
We have made this a priority.
The goal to increase the reimbursement rates for rural hospitals, helping level the playing field and increase opportunity in Appalachia, because if the hospitals were to close,
it puts these communities into a death spiral.
As Ballard prepares to open the country's newest rural hospital this summer in Lee County, focusing on the problems helps every hospital nationwide stay open.
The story of Ballard as a rural health system is a national story. 85% of our geography is rural, and it's really too bad that it's been forgotten.
Now, Ballard says its goal is not just keeping these hospitals open. It's bringing in better health care to the region, more doctors, competitive pay for nurses, and new technology, something they say their merger has already kick-started in the region. Coming up at 6 o'clock, we're taking a closer look at that bipartisan legislation that's meant to fix this problem. Josh?